Welcome, Dr. Alan Katz.
Thank you.
You set out to find ways of measuring the quality of care doctors give. Why did you want to be able to measure that?
Well, for many years we relied on physicians to rely on their own professional standards and professional ethics and professionalism as a way of making sure they did the right thing for their patients and did the best possible, provided the best possible care. It's not really inappropriate to recognize that professionalism isn't enough. And we know from a variety of different professions and other areas that even though physicians do their best and what they believe to be the right thing, it doesn't always turn out to be the case. So if we really want to know what people are doing, we have to measure it. So the idea was to look at what's actually happening in reality and say, do we have a problem, or are physicians really doing what they think they're doing and they think they should be doing?
And what sorts of things did you measure?
We looked at indicators of physician practice in 3 or 4 different areas. We were interested in preventive care, for instance, which is something which is really a key part of what primary care physicians do. So provision of things like pap tests and immunizations both to children and adults under various circumstances. These are common things that physicians do all the time or should do all the time. And the question is, well, are they doing what they think they should be doing? We also looked at chronic disease management, monitoring of a variety of chronic diseases, and some other screening tests that family physicians say they should be doing and the literature supports them doing, and in reality they should be doing.
Can you tell me some of your findings?
Well, our findings varied across the different indicators. For example, children's immunizations, something that have been around for many years and is just a routine part of care. The reality is that only about 70 to 75% of children are getting the immunizations that they should be getting. For things like diabetics are supposed to have their eyes checked regularly to make sure that they're not developing problems as a result of their diabetes. Well, only about 37% of people who should have an annual checkup are getting that checkup of their eyes. That's concerning because that means that people with diabetes may be developing serious consequences that could lead to blindness. The idea of the annual checkup is to be able to intervene quickly. Patients with depression, people when they're prescribed an antidepressant for the first time should be seen for follow-up. We found that probably about 45 to 50% of people who should be seen 3 or 4 times in the first 2 months of being depressed and needing a medication were getting that follow-up. Others weren't, which means that they were at risk for other consequences, even suicide. So people with that kind of serious illness need to be followed up, and they weren't all being followed up. We found that people weren't necessarily getting the flu shots they need. Flu shots are preventative, particularly with people with heart disease, chronic lung disease. It's very important for them to get the flu shot to prevent them getting sicker. So these are some of the conditions where people weren't getting the care they need, and as a result, potentially they were put at increased risk.
Are doctors aware that they're not doing as well as they think?
I think most doctors, and I speak for myself as well in this, I think we believe we're doing as well as can be expected. And generally when you ask doctors, how are you doing, they think they're doing well. Turns out that when you actually measure what they're doing, it's not quite as good as they thought they were doing. So most doctors are a little bit surprised when they see their results, when you actually give them the results of what they're really doing. And I think that's just human nature.
They've never really had a chance to compare, have they? They work hard, but they haven't had a chance to check their own progress.
Well, that's the issue, that physicians have never really had an opportunity to know what they're doing, other than the fact that when you're sitting with a patient in a room, you consider what does this patient need done, and you do it as best as you can recall, and you hope that you've done the right thing. But one of the things that's really changed in the last 10 years is the availability of electronic medical records, which it really provides physicians with an opportunity to measure what they're doing. The alternative in the old system where you had paper charts was to go to the medical records department and pull a whole slew of paper charts and look through them one at a time and say, what should I have done with this patient, and then try and count it up and see what's happening. A lot of work, nobody has time for that, it wasn't happening. So with electronic medical records, we're hoping that this will become more of the routine and that physicians will have the opportunity to keep track of what they should be doing.
What were they doing poorly on, did you find?
Well, an example of the greatest concerns I had was monitoring, for instance, with anticoagulation. These are drugs that patients are on where you're supposed to be doing blood tests a minimum of once a month to make sure that the patients are getting the right amount of drug, because circumstances change.
That's a stroke preventive, isn't it?
Absolutely. It's to prevent stroke predominantly, and also for some patients for heart disease too, but mainly for stroke. And diet can change the dosage of the drug needed. Addition of other drugs can change the dosage needed, and a variety of different things. And in fact, we know that those patients whose bloods are not monitored are more likely to have the readings out of the range, and as soon as you go out of the range, the side effects of the drugs increase. So only 35% of patients in the study we did were having monthly blood tests over the previous year. That's concerning.
Were you seeing wide variations? Does it change a lot between doctors, or do they tend to be bad on the same things?
No. Wide variations both across different indicators and different physicians, with great variation across different indicators. So one physician might do very well for some of their patients in one area, and then not so well in another area. Or they might do very well for all of their patients in one area and very poorly in another area. So there was great variability both within indicators and across indicators for different physicians. The reality is that we didn't find there were a group of bad doctors. That's not what we found. We found human nature. We found variability in practice, which is both encouraging and concerning.
What actions would you like to see taken? You've established these variations. You've seen there's some weaknesses, some strengths. How do you improve quality with the knowledge you've developed?
Well, I think it's building on the strengths. One is electronic medical records, which I've mentioned, and I really believe that the time has come for us to really push for funders and licensing bodies and everybody to get on side with recognizing that physicians need the tools to do a good job. And this is the prime tool that will allow physicians to be able to monitor what they're doing themselves.
So we need some leadership on that.
Absolutely.
Thank you very much.
Thank you.